now, the system is breaking down. Schools and hospitals are built on the assumption that teachers and doctors will always be there, yet across rich countries, that assumption is on a collision course with reality. Despite all the apparent advantages, schools and hospitals are finding it harder to stay fully staffed. For most of the past century, the way rich countries supplied essential workers followed a fairly predictable pattern. Teachers and doctors were trained domestically, usually through heavily subsidised public systems, because governments understood these roles as core national infrastructure rather than ordinary market jobs. Each year, a new cohort of graduates would enter classrooms and hospitals, while older workers gradually retired. As long as the number coming in roughly matched the number leaving, the system stayed in balance. Schools remained staffed, hospitals kept functioning, and shortages were rare and usually temporary. That model worked because the underlying demographics supported it. Back then, populations were younger, birth rates were high enough to guarantee a steady flow of future workers, and demand grew slowly enough for systems to keep up. Training capacity didn't need to expand aggressively because replacement was gradual and largely self-sustaining. But now, the system is breaking down. Across almost every high-income country, populations are aging rapidly, which puts pressure on healthcare from two directions at once. Many doctors are approaching retirement just as the population itself is getting older. In countries like Japan, Italy, and Germany, more than 1 in 5 people is already over the age of 65, and that share continues to rise. And older societies need more healthcare, not less, because people live longer and spend a greater share of their lives managing chronic conditions. At the same time, birth rates across developed countries have fallen well below the replacement level of 2.1 children per woman. In countries such as South Korea, Italy, Spain, and Japan, fertility rates now sit closer to 1.2 or lower, and even historically higher fertility countries like the UK, France, and the Nordics have seen sustained decline.